Now we are going to move to our next award, which is the Michael Smith Foundation for Health Research Aubrey J. Tingle Prize. And presenting that award is going to be Dr. Eleanor Wilson, the chair of the board of directors. Eleanor?
Thank you. Thank you so much, Wendy. This year is the 20th anniversary of the Michael Smith Foundation for Health Research, and it has been a challenging year. The last year has reinforced the need for and commitment to a future where health research plays an even stronger role in improving people's lives. So it gives me great pleasure to present the Aubrey J. Tingle Prize. This prize is presented to a British Columbia clinician scientist whose work in health research is internationally recognized and has had a significant impact on advancing research and the uptake of evidence to improve health and the health system in BC and globally. This year's winner is Dr. Ruth Grunau. Dr. Grunau, a psychologist, is a professor in the Division of Neonatology of the Pediatrics Department at the University of British Columbia and a senior scientist in the BC Children's Hospital Research Institute. Her early work in measurement of facial indicators of infant pain made a landmark impact on the field of pain assessment and has been adapted and used worldwide, both clinically and for research. With funding by the NIH and the Canadian Institutes of Health Research, she has published more than 200 refereed journal articles and 34 book chapters. More recently, she is known internationally as the leader in the long-term effects of neonatal pain in infants born very preterm at 24 to 32 weeks. Dr. Grunau's multidisciplinary research has shown that there are long-term consequences of daily procedural pain in these infants at a time of rapid brain development and programming of stress systems. These findings have impacted neonatal hospital care worldwide. Dr. Grunau's work on pain recognition and management in infants improves day-to-day life for society's most vulnerable during NICU and early life interventions to lessen the impact of chronic pain and medical interventions on brain development. I invite you to watch the following video and hear from Dr. Grunau herself.
So after completing my PhD in 1985, I went to a position at Children's Hospital in the neonatal follow-up program when it was established in '88. I came into the Institute at the very beginning, and without Dr. Tingle and without the Michael Smith Scholar Award, I would not be where I am today. So I really want to express my gratitude. My role as a psychologist was to assess children born extremely tiny. Infants born 2 to 4 months early undergo around 10 invasive procedures daily while hospitalized for weeks to months during a period of the most rapid brain development and programming of stress systems. Our work has had a major clinical impact on neonatal intensive care, identifying pain stress as a modifiable risk factor with long-term consequences, and thereby the importance of pain stress management. So while studies of development of very premature babies have shown persisting problems through to adulthood, our work has shown that there's aspects of parental involvement, such as sensitivity to child cues during simple teaching tasks in toddlerhood, in early childhood, can to some extent ameliorate the adverse contribution of the early pain and stress. Development is highly plastic. The brain is developing throughout this period, and there's no question that the environment that the child is raised in can have very positive ameliorative effects. The new Children's Hospital, NICU, was built for accommodating and facilitating parent involvement with their babies. The importance of this has grown from many directions, including our work on the long-term effects of pain and how important it is to have parents doing skin-to-skin care and helping parents reduce the baby's stress. Improving the lives of preterm infants at this point is improving their neurodevelopmental outcomes. And I am very fortunate, together with my multidisciplinary collaborators, to have been able to add to the understanding of factors that contribute to these children's development, and hopefully will lead to more optimal outcomes in the long run.
Now I would like to invite Dr. Grunau to say a few words.
Thank you, Dr. Wilson, for your generous introduction. I'm thrilled and honored to receive this award. Especially, I would like to thank Dr. Aubrey Tingle, who played a key role in the establishment of my research career early on. Thank you also to the Life Sciences BC and the organizers of today's event. I'd like to express my appreciation to the Michael Smith Foundation for Health Research for this award and for my Senior Scholar Award in 2002 that launched my career. And thank you for tremendous support from the BC Research Institute for Children's and Women's Health over the past 20 years, the Pediatrics Department at UBC, and my division, Neonatology. My work is truly multidisciplinary, and I want to express heartfelt appreciation to my colleagues, including Drs. Joanne Weinberg, Michael Whitfield, Ann Sinnis, Stephen Miller, and so many others, too numerous to name at this point. I'm forever grateful to my fantastic students, postdocs, and research staff who made it all happen, and for the invaluable support of the clinicians and staff in the Neonatal Intensive Care Unit and Neonatal Follow-Up Program at BC Women's Hospital. I'm truly indebted to the families who participate in our studies and return year after year for longitudinal studies. Lastly, I would like to deeply thank my husband and my 4 children for their support and for putting up with my research bug all these years. Again, thank you very much for this prestigious award, which means a great deal.